Good morning, everyone, and thank you for joining us today. May 12th is ME, and I'm going to let Dr. Davis actually pronounce it. I'm just going to call it ME Day, Awareness Day. ME is an autoimmune disease previously known as chronic fatigue syndrome. It's a chronic, complex disease where people living with ME typically experiencing worsening symptoms after they exert themselves physically or mentally. Although the exact cause is unknown, in many cases, ME develops after an infection. Prevalence and awareness of ME has grown over the last few years, with many people impacted by long COVID. Unfortunately, we are living through a time when federal funding is being slashed for critical medical research and disability programs, and massive layoffs are ongoing at HHS, the CDC, NIH, and our top health agencies. In fact, a large research center at Columbia University dedicated to researching the chronic condition was forced to shut down in March due to the Trump administration's cuts. The harmful decision to cut funding is a huge blow to the millions of Americans living with ME. While there's so much we need to do surrounding research and education on diagnosis and treatment of this illness, one of the best things we can all do is help raise awareness and understanding about the disease. I'm grateful that we have groups like ME Action Maryland who work every day to advance awareness, recognition, care, and support for ME, long COVID, and other chronic conditions. They offer support to those living with chronic conditions, advocate at the state and federal level on important healthcare related bills, and provide education to Maryland residents and healthcare providers. However, the burden cannot be solely on those impacted by this disease. We must all step up and help support and uplift our residents living with ME, long COVID, and chronic conditions. In Montgomery County, we will continue to advocate for research funding, education, and improved access to disability services. And I'm glad everyone could be here today. And I'm going to turn it over to Dr. Davis now.
Thank you, Council President. So today I am honored in recognizing May 12th, which was yesterday, as Myalgic Encephalomyelitis, Chronic Fatigue Syndrome Awareness Day. That was done intentionally. May 12th is also National Nurses Day, and so that was done intentionally to link the two of those together. ME, or chronic fatigue syndrome, it's also known as, is a complex, debilitating condition that affects an estimated 1 to 2.5 million Americans, including many here in our own community. Yet it remains widely misunderstood, underdiagnosed, and often invisible. ME is far more than feeling tired. It brings profound exhaustion that is not improved by rest, cognitive impairment, often referred to as brain fog, pain, unrefreshing sleep, and perhaps most distinctively, post-exertional malaise, a worsening of symptoms even after minor physical or mental activity. Many individuals with ME experience a dramatic loss of quality of life. Some are homebound or bedbound for years. Many face stigma, disbelief, and a lack of access to adequate care. This is not due to lack of will, but rather a lack of research, clinical understanding, and public awareness. There is growing awareness of post-viral illness due to long COVID, which shares many features with ME. This moment presents a critical opportunity to advance understanding of ME through shared research and advocacy. Montgomery County supports this work and urges continued scientific investigation and collaboration. We remain committed to equitable access to health care for all residents, especially those with chronic complex conditions. We encourage residents to learn more about ME and support those affected. Let's listen to their stories, advocate for better care, and ensure that no one suffers in silence. Together, we can raise awareness and promote change in our county. Thank you for your time and attention to this critical issue. Your support helps to shine a light on illness that too often lives in the dark. On behalf of Montgomery County, I'm proud to present this proclamation in recognition of Myalgic Encephalomyelitis Awareness Day.
Thank you so much, Dr. Davis. And it is so important that we hear from members of our community so they can share their stories. And we're very thankful to have Bridget Collins with us of the ME Action Maryland. She's the chair of the chapter, and I think she's going to say a few words.
Thank you. Thank you, Dr. Davis. Thank you, Council President. And good morning to everyone. My name, as they said, is Bridget Council. I live in Rockville, Maryland. I'm the chair of the advocacy group ME Action Maryland, which is part of a national nonprofit, ME Action. ME, as they said, stands for Myalgic Encephalomyelitis, which is a very hard to say disease. It is a disease that for some people is triggered by an infection or virus, and anyone at any age can contract it. It is a severe condition characterized by debilitating exhaustion, as well as mitochondrial, neurological, and immune system disturbances in the body, to name just a few of the condition's markers. And I am so proud to be a resident of Montgomery County because the council crushed describing this disease. I'm so amazed. You guys did such a great job. Thank you so much. So I'm not going to go into it very more because they did such an amazing job. We picked May 12th because it was Florence Nightingale's birthday, and she was believed to have had ME. For myself, I have suffered from ME for 30 years, since I was 11, which is how I know that ME can steal lives. And throughout all these years, well, I'm lucky. My parents are with me here today. And I'm lucky because they were with me throughout those years. But that is not true for most people, because most people don't have adequate support. So one thing we do when we raise awareness is we raise awareness that most people need better support. So I'm really grateful to the Montgomery County Council for helping us raise awareness today. Yesterday, I was protesting in Washington, D.C. at the Millions Missing rally. We named the event Millions Missing because millions of us are missing. We're sick at home, missing from our previous full lives. We're missing from your lives. We're unseen, not able to fully contribute, not just taxes from the jobs we're too weak to hold, but unable to contribute the wealth of our many talents to our families, our communities, and to our country. For these reasons, we raise awareness of those with myalgic encephalomyelitis, and we honor the caregivers, researchers, doctors, and policymakers who support them. Thank you for this recognition.
Thank you, Bridget, and thank you to your parents for being here and to sharing that, your story. We really appreciate it. Dr. Davis and I will read the proclamation now. Oh, you're going to read the first one.
Myalgic encephalomyelitis is a chronic, complex autoimmune system disease that drastically limits the lives and activities of those who contract it. And
whereas prior to COVID-19, ME already afflicted at least 46,000 Marylanders of all ages, races, sexes, and socioeconomic status, leaving many housebound or bedbound, with students unable to attend school and 50 to 75% of adults unable to work, leading to a loss of $319 to $450 million annually in lost productivity in the state of Maryland. And
the majority of ME cases are likely initiated by infections such as COVID-19. It is noted that following the recent pandemic, the prevalence of ME grew exponentially to afflict between 295 and 340,000 Marylanders. And
whereas greater awareness of ME locally and nationally should lead to increased government and private research funding, as well as to the updated formal clinical education of frontline medical practitioners, and that this education will lead to faster, accurate diagnoses, appropriate treatments, reduced medical costs, and improved access to disability resources.
Now, therefore, be it resolved that County Executive Mark Elrich and the entire Council of Montgomery County, Maryland, do hereby proclaim May 12, 2025 as Myalgic Encephalomyelitis Day.
Great. Thank you. And so we'll take a picture now.